What is subretinal fluid in retinal detachment? Imagine a tiny space at the back of your eye where fluid can sometimes gather, causing big changes in your vision. That's what happens with subretinal fluid in retinal detachment. The retina is the light-sensitive layer that helps you see, and it sits snugly against the back of your eye. When fluid builds up beneath it, it pushes the retina away from its normal position. This separation is called retinal detachment, and it can lead to vision problems if not treated promptly. Subretinal fluid is basically the fluid that collects in the space between the neurosensory retina, which is the part that detects light, and the retinal pigment epithelium, a layer that supports the retina. When this fluid accumulates, it causes the retina to lift or detach. The cause of this fluid depends on the type of retinal detachment. In the most common type, called rhegmatogenous retinal detachment, a tear or hole appears in the retina. This tear allows the gel-like vitreous inside the eye to seep through and fill the space under the retina as subretinal fluid. This process lifts the retina away from the underlying tissues, which can cut off its blood supply and lead to vision loss if not fixed quickly. Another type, exudative or serous retinal detachment, happens without a tear. Instead, fluid leaks from blood vessels in the choroid, the layer beneath the retina. Conditions like age-related macular degeneration, inflammation, tumors, or infections can cause this leakage, leading to fluid buildup under the retina. There is also tractional retinal detachment, where scar tissue on the surface of the retina pulls it away. Sometimes, this pulling causes fluid to gather under the retina as a secondary effect. The presence of subretinal fluid is a key sign that the retina is no longer in its proper place. This separation impairs the retina's ability to function properly, which can cause blurry vision, flashes of light, or a shadow in your field of vision. The fluid-filled space is called the subretinal space, and the fluid itself is known as subretinal fluid. Understanding this fluid is important because it helps doctors diagnose the type of retinal detachment and decide on the best treatment. Treatments aim to stop the fluid from accumulating further and to reattach the retina. Procedures like laser surgery, cryotherapy, or vitrectomy are used to seal tears or holes and remove or drain the fluid, helping to restore or preserve vision. In summary, subretinal fluid in retinal detachment is the fluid that collects beneath the retina due to tears, leaks, or pulling forces. This fluid causes the retina to lift away from its normal position, disrupting vision and requiring prompt medical attention. If you notice sudden changes in your vision, it's important to see an eye specialist quickly to prevent permanent damage. Always consult with healthcare professionals for personalized advice and treatment options.